And with COVID-19 cases rising and concerns of a vaccine shortage, the pandemic shows little signs of slowing down. CBS 4's Joan Murray joins us with a breakdown of just how slow our road to recovery is months after it began.
When you look at the numbers, you can see that the COVID crisis is far from over in South Florida. Hospitalizations going up, and people are still getting sick. 10 months into the pandemic, and COVID testing is a well-oiled machine, if not a little slippery. Some testing sites have gone away. Others, like Mills Pond Park in Fort Lauderdale, there's a long line to get a PCR test.
The officers say that it's not too fast.
Yeah, it's 2 hours.
Some people around the office were exposed, and they weren't really telling us that those people were exposed.
My dad is 84 years old, and he just want to make sure that he's good.
Even before the vaccine, we can do the mask, the distancing, the not being in groups.
Hospitalization rates are ticking upward in both Miami-Dade and Broward. In Broward, there are 919 beds available, or a 17% capacity.
We have seen a slow, steady increase in the number of cases in the community and the number of cases that are coming to the hospital, undoubtedly due to the recent holidays.
In Miami-Dade, the picture is more serious.
We're still the fourth most affected county of all counties in the United States, and we're number 7 in terms of deaths of all the counties everywhere in the United States. So that's really not good.
But infectious disease expert Dr. Ailey Barty says treatments have improved, so people are leaving the hospital sooner. According to the county, Miami-Dade has 1,163 COVID patients in the hospital, and they occupy 241 ICU beds.
The estimates now are that we need 90% of the population protected before we'll really be able to go back to normal. And if you think about that, we've vaccinated less than 1% of our population at this time.
There are reports of wealthy and well-connected people jumping the vaccine line in South Florida.
Just goes to show that there's been one pandemic for the rich, and there's been another pandemic for the rest of us who are not rich and well-connected.
Despite the slow vaccine rollout and the surge in sickness, South Florida does have enough hospital beds for now.
We still have the capacity presently, and then we can implement our crisis or our contingency plans for breaching that wall to continue to take care of the people that need us to do so in the community.
There is hope the vaccination schedule in South Florida will start to make a difference, but don't expect to see any true improvement until the summer. In Fort Lauderdale, Joan Murray, CBS 4 News.